Previous studies have shown a decrease in muscle force production when a single muscle fiber is above or below resting length. However, these studies were only looking at single muscle fibers, and by looking at biarticular muscles, we could gain a better understanding of these muscle mechanics and apply them to daily life. The purpose of the study is to answer the question, what is the length-tension relationship in the biarticular muscles of the hand and wrist? For this study, I hypothesized that the force generated by the flexor and extensor muscles of the wrist during a peak force test will be highest when the wrist and hand are in a neutral position. We gathered 8 subjects with a mean age of 26, 5 females and 3 males. All of the subjects were physical therapy students at Regis University. The subjects had to have been between the ages of 20 and 35 and able to read and understand English, as well as present pain-free and range of motion of the upper extremity of the dominant hand. Subjects were excluded if they had a history of surgery or experienced pain in the last 6 months that restricted them from activity or required medical attention. We started by placing the electrodes in the middle of the muscle bellies. We then made sure we got good connections with the electrodes by shaving and cleaning the area with alcohol swipes, and then testing to make sure we got readings. Following that, we adjusted the hand grip dynamometer to have a comfortable neutral grip, making sure that the fingers were not too flexed or extended. We then performed a maximum grip test in a standard position, short hand grip, long hand grip, extended wrist, and flexed wrist, and we recorded the force in kgs on the dynamometer and peak activation from the EMG. Measurements were calculated using a percent of the maximum grip force. This was done to normalize the data, making it relative and comparable between subjects. The descriptive stats calculated were mean and standard deviation. The graphs shown have the different wrist positions on the x-axis, and the y-axis is the percent of the neutral position for either peak force or peak activation of the flexor and extensor muscles. The peak force, you can see that the positions measured were below 100% of the neutral position peak force, meaning that none of the positions were able to produce a force equal to or greater than the neutral position. This also went for the peak flexor activation. However, for peak extensor activation of the long hand grip and extended wrist, they were greater than 100% of the neutral position. Because peak force and peak flexor muscle activation was less than that of the neutral position, that supports our hypothesis. This also supports previous literature that stated that muscle fibers produce most force at a relaxed position. Peak extensor muscle activation varied in results. Long hand grip and extended wrist position showed that they were measured above 100% of the neutral position, and this did not support our hypothesis. This gives us better understanding of muscle force concepts relating to whole biarticular muscles, and this can help us understand optimal position for musculoskeletal rehabilitation. Also, patients who don't have full range of motion, this can also tell us why they may lack strength. Thank you for listening.